Is there any like mindset, belief, or attitude you had early in emergency medicine that has gone away in the reality of the job?
Yeah, and I would say it's not about the job, it's more about myself. I have followed a quite stereotypical path of being somewhat of an adrenaline junkie and loving nonstop excitement, also thinking I'm invincible in a way, right? Like in residency, at the end of night shifts, we had so little time in residency. At the end of night, if I was on the end of night shifts, that was like a day off. I mean, I may work overnight 12 hours or more, but then I don't have to go to work until the following day. That's like a gold mine. Yeah. So I would never, ever sleep after the end of a night shift. Now, of course, like if I'm on 5 nights in a row, I would sleep after nights 1 through 4. After night 5, I had that day to recover, so I would just keep going. So that doesn't work. It doesn't work forever.
Yeah.
So my mindset change is understanding the importance more of longevity and taking care of yourself. I'd say as far as like how I view the job, it hasn't really changed much.
Yeah. Yeah, when I was a paramedic, I could do 84-hour weeks all the time, and that was before I had kids and, other responsibilities. I think it's easier when you're younger to feel like you can work 1,000,000 hours, but now I know if I'm considering working an extra shift or whatever it is, I know what that'll take from me. And so I have to consider that too. It's like that extra day, even one extra day a month, can take its toll. And I'm not as resilient to lack of sleep as I was in my 20s. And, it does take something more from you, I think.
Eventually, especially in a field where your income is pretty good, your lifestyle is, you're nearly guaranteed to live a comfortable life, right? You're not going to be rich, but you live a comfortable life. Almost universally, everyone will eventually realize, and it happens at a different point in time for different people, your single most important asset by a long shot is time. And in the beginning, you're willing to give up lots of time because you feel you can pull it from somewhere else. You're never going to get more time. You're never going to get more than 24 hours in a day. As you get older, as you need a little more rest, as you have more family duties, you've got to understand that, like, protect your time big time. So sometimes that may mean not taking on the extra task, not picking up the extra shift, cutting back a little bit, not a lot, but time will eventually be your most important asset to every single person out there.
Yeah. Do you have any keys to staying in such a challenging field throughout a whole career, like how to maintain that longevity and kind of not burning out when you're in your 60s and not being that physician that we all see occasionally, or whatever specialist that has horrible bedside manner or clearly doesn't care about the patients anymore? Like, how do you avoid becoming that person when you're getting close to retirement age?
I think that goes, are you saying I'm at retirement age?
No. You're not even close.
No,
you got 30 more years.
I'm kidding. But I think that, a lot of our theme today is mindset, is intentionality, being purposeful, having the right mindset. And you've got to do that all the time. You've got to have the mindset of, like, I'm going to take care of myself. I'm going to take care of my family. Purposeful gratitude. It is so easy to be jaded. It is so easy. Be intentional about being grateful. That will solve 60% of burnout problems. So, for example, we have an area, we call it intake, but it's basically like triage, where the doctor's at the front of the emergency room and we see and screen every patient that comes in who doesn't come in by ambulance. So for me as a physician, in an 8-hour shift, that could mean anywhere between 50 or 110, 120 patient encounters in 8 hours. It is super rapid pace. Anyone and everyone can come in and say whatever they want. So there are some of those encounters that are frustrating because sometimes patients can be just flat out, not even just rude, just mean, just nasty, really nasty to you and to other staff. And so it's real easy. Let's say in an intake shift you have 5 of those. That is a lot. That's a lot to deal with in one day. If you have 5 people who are just really mean and really nasty.
Yeah.
You could go home and just dislike your job, dislike that shift, dislike your fellow society, your fellow neighbors. But you have to be intentional and say, okay, that was 4 or 5 out of 45 to 100 more people who a lot of them are genuinely very, very grateful, very nice. They're scared. They woke up in the middle of the night. They dragged their kids in. They did all sorts of stuff to be seen and told, don't worry, it's nothing dangerous. And they go home and they say thank you. Like, be intentional about remembering those things. Honestly, that's super, super important.
Yeah. Yeah, not fixating on the negative, I feel like, is a reoccurring theme. Like, you have to be intentional about remembering the good, because there is a lot of it. And I think a lot of people don't have that intentional mindset to remember that piece of your day. And it's so easy to remember the negative. I mean, the last triage shift I worked, I could probably pinpoint each patient that was extremely frustrating, that was super rude. They don't understand the scope of the ER and what we're capable of, what we're not capable of. And I could probably pinpoint. I probably remember what they look like, that evening. But did I actually make the point of like, this person was really grateful. They were super nice. They thanked everybody for their time. And like, it really requires a lot of intentionality to remember that positive, because I feel like it really does go by so quick.
Yeah.
And you can't remember that nice patient like you do the negative patient.
But they exist. They exist every single shift. I guarantee it. They exist. Not only do they exist, they're actually the norm. People are still nice. Even in challenging situations, when they're under duress, most people are still very great. And I don't think we talk about intentionality enough. The obvious things for preventing burnout are taking care of yourself. I mean, I can't talk enough about healthy lifestyle. And for me, it's pretty hardcore about exercise and fitness, but it doesn't have to be that way for everyone. What makes you feel good? What sparks creativity? What makes you sleep well? What makes you smile? What makes you more grateful? Recognize that and then do it. Make that a priority. Exercise has to be a priority. Sleep has to be a priority. They can't be things that we fit in when it's convenient. It doesn't work that way. And I think most people know that. I don't think that they practice it, but they're at least aware of it. Most people don't need to be told that. And then for those of us who are coupled, whether we have spouses or a boyfriend or a girlfriend or a significant other or something, like, don't underestimate the role that those people play in your life and how you need to nurture that relationship. You need to cherish that relationship. You need to give to them, but you also need to allow them to give to you. You need to gain strength from your significant other when you're down a little bit, because they're there. And a lot of times, again, we're in a field where we naturally feel invincible, for lack of a better term. But with your significant other, spouse, kids, family, everyone, realize that that's like, they're there for you. So nurturing those relationships, being purposeful about time together, being grateful, laughing, spending time, you've got to do that. You cannot be, gone are the days of the old school physician where he got up, went to work, came home, and that was basically it. And then spouse and kids are taking care of everything else, cooking, cleaning, doing all that stuff, and you just go to work. That doesn't really work for anyone anymore. I mean, very, very rarely. So, like, you've got to, like, make your home life good. And you have to be accepting for what your spouse is willing to give you and help you with, and help talk things through and help come up with new good ideas and support each other. If those things are, like, when my wife and I are connecting well and we're discussing things and making plans and getting along really well, like, I feel like I can take on the world. And when things aren't as great at home, frustrated with the kids, haven't had a really good, just like fun thoughtful conversation on the couch with my wife, like things get a little more difficult.
Yeah.
So that's another thing that people kind of overlook when it comes to burnout.
Yeah. Yeah, I mean, even like fatherhood's changed in the last few decades. It's not the leave it to beaver, husband goes to work, wife stays home, husband just sits on the couch at the end of the day and drinks a beer and then goes to bed. Like you are still often your spouse is working now too. In this modern society, usually both people are working. So the wife's busy with things. You're both trying to simultaneously raise the kids. Like you don't just come home and sit on the couch. You need to participate in family stuff and spending time with your kids, and, your day off, you're helping raise the kids. And
yeah, it's so easy to come home and just feel that each spouse feels the other one doesn't understand them, right? Mm-hmm. You have different jobs, you have different expectations, but you also have different like strengths. Your strengths are different from your spouse's strengths, and it's easy to feel disconnected, and it is super easy to just become complacent and not really understand the importance of like, I'm going to come home, I'm going to put my best foot forward, I'm going to smile, I'm going to hug my wife, I'm going to ask her about her day, and I'm going to allow her to give me strength.
Mm-hmm. Yeah, that's good. If you could give one piece of advice to a new ER physician, which we see fairly regularly, what's the advice that you give people just starting in their career?
I give the same advice that you and I've talked a lot about today. I appreciate their ambition. But I frequently have discussions. They want to know all sorts of things about medicine, and understandably so. You've got this fresh resident or fresh medical student, and when I'm one-on-one with a medical student or resident in the emergency department, most of what I do is teaching them medicine, bedside cases. But I really, really try to talk a lot about all the lifestyle stuff. So when we're bedside, we're talking medicine. When we're walking down the hall, or we're sitting there documenting, and I want to get up and get coffee, I tell the student or resident to come with me. And I just kind of fill there the whole time of like, what do you do for fun? Like what? And it's crazy how many people are like, well, I used to run. I used to sing. And I'm like, what do you mean used to? Oh, well, I'm in medical school. I don't have time anymore. I'm like, no. It's more important. The busier you are, the more stressed you are, the more you have on their shoulder, that's the timing when it's more important to take care of your hobbies. Now, they may have to change. You can't, play baseball 2 hours every single day. It's not really realistic. It may have to change, but like to let it go completely. So I talk a lot about lifestyle, taking care of yourself, being happy, assessing what challenges you and what doesn't. A lot of it has nothing to do with medicine at all.
Yeah. Well, it's about having that identity outside of being an ER physician or a PA. Like that should not be your whole identity. You should have things outside of work that give you life, whatever that is. I mean, like Anne is winning ultra marathons, like things outside of work that can also be part of your personality as opposed to just it being work, which I think is hard as a physician. You devote so much of your life to your undergrad and then medical school and then residency, and then you're expected to work a lot of hours. I think it's probably harder as a physician to not make being a physician your entire personality. I think PAs have that a little bit better because the work to get there is not nearly as much. You get undergrad and then you have a couple years of PA school, and then a lot of people don't do any kind of residency. You start in whatever specialty and kind of learn as you go. So I feel like that identity isn't as much of a struggle for PAs. They tend to have a little bit more of that balance, I think, but that's a hard thing when you devote so much of your life to education and getting to that role.
Mm-hmm. Yeah, and community, wherever your community is, when you're at home, it's your family, it's your neighborhood. At work, it's your coworkers. But a lot of people, again, even more in this field, they wear this badge of honor about like constantly grinding, or one of the ones that bothers me the most is like, I'm a lone wolf. What happens to lone wolves? they die.
Yeah.
Like there's nothing, it's the funniest term, like this being super independent. It's great, but it's gone too far the direction of being independent, and you don't need anyone, and you can do whatever you want, and don't let people hold you back and stuff. You know what? But don't let people not propel you forward. Mm-hmm. So lean on each other, bounce ideas off each other, talk to people, ask about people's lives. Again, these are all things that have nothing to do with medicine, but they're going to make your life in medicine more rewarding, and you're also going to be better at medicine if you connect with people, and if you accept help, and if you give help.
Yeah, I think it's easier when you're in the clinician role in the ER. My natural bent is just to like nose down, like looking at my computer, just doing the work and kind of be mechanical about it, as opposed to like my coworkers want to talk. Like people want to talk about things that are going on. They want to talk about the hard parts of their day. And it's so much more rewarding to actually talk with the people around me throughout the day, as opposed to just staring at the computer and just doing my job throughout the day. Like that'll burn you out real fast if you're just focused mechanically on doing the tasks you have to do throughout the day, as opposed to talking with people about their lives and making sure everybody understands the plan on patients, and just not just talking about work stuff.
Yeah. But, you know, back to what you had asked about advice for like someone new in the field, whether it's a student, a resident, or an aspiring individual wanting to get into the field. We see these patterns. Most people who go into this field are not just workaholics. The personality in emergency medicine, pre-hospital, inter-hospital, whatever, it draws a personality of people who are usually more adventurous than your average human. Therefore, they usually, as an average, not on an individual basis, but an average, they usually have more hobbies and are involved in more things. But I see this pattern. You get these people who've lived their whole life. They've been very ambitious. They've been very involved. They achieve their ultimate goal of getting into medical school, but they don't realize that's not the end. That's only the beginning of your goal. So you got to change your mindset once you get to that point. Then they get into medical school residence, and all of a sudden they work super hard. They want to achieve, and what do you see happen? You see hobbies fall off, exercise fall off, sleep fall off. You see relationships all the time being compromised. Not just romantic relationship, but relationship with your friends, with your family, with your coworkers, whatever it may be. You frequently see relationships suffer. And then people start practicing, and then at like that 7-year mark, people start to notice like, I'm not doing this right. I need to balance my life out better. I need to be happier. I need to be more grateful. And then they start doing it again. Have you ever met anyone who said, I should have waited a little longer to balance my life out?
Right.
Never.
Yeah.
Not one single time.
Yeah.
So listening to people who have gone through it ahead of you and making that more of a point earlier on than the average person is going to lead to success.
Yeah. Yeah, I feel like I let a lot of social relationships go when I was a full-time paramedic, getting my undergrad, going to PA school. I had to say, I mean, some of it's time constraints too. You know, I had to say no to so many social things, birthday parties, you know, stuff like that went by the wayside for so long. And in the last few years, I'm like, I actually need to prioritize that stuff, because it actually gives you life. You know, it actually is so much more rewarding than just focusing on work and education. And certainly there's that period of time where you probably have limited time and you have to devote that to med school, PA school, whatever it is. But like you said, putting that off after you're practicing, you've achieved that goal. You can't keep putting it off and putting career as the number one priority all the time.
No, because then paradoxically, you're going to be pretty terrible at your career.
Yeah. Yeah.
But yeah, it's just a pattern that we see frequently.
Yeah.
So if someone wants to be extra good, break the pattern a little bit.
Yeah.
Balance is hard. It's hard. It is really hard to balance out increased duties and still try and keep everything else. It's not going to get any better. It's not going to get any easier. It's going to get different. But if you realize going through your early adult life into your normal adult life, now once you're retired, sure, things get different and lots of new time opens up after children leave the house and you're not driving them to soccer practice 5 nights a week and stuff like that. But the majority of your adult life is going to be spent busier than you were in residency or medical school. It's just a different type of busy. It's not all academically busy. But if you can learn that balance early on, you're going to be one step ahead of everyone else.
Yeah, there's not like this magical point in time where life's going to get less busy and easier to schedule things. It's always going to be hard. I mean, short of retirement where you have all this time opening up, it's always going to be hard. So it's a matter of what you give priority. And it's just, you have to work for it. I mean, I think that's true with like kids. When you have little kids, you're like, oh, life will be easier when they're a little older. Like, it's not easier, it's just different.
Right.
Like the challenges with kids are just different as they get older. So if you're putting things off, vacations or social things, because you're waiting for your kids to be older and easier to manage, they're not going to be easier. It's just going to be different. You're not going to have to change their diapers anymore, but you still got to make sure they're using the bathroom so they don't pee their pants. And then after that, you got to worry about their social relationships with other kids. Are they getting along with kids? Are they all treating each other? Like, it just changes. It doesn't get easier. The challenges are just different. So there's no point in putting that stuff off.
Yeah.